you so much. Thank you, Hosmac, for arranging this seminar. It's been informative. I've enjoyed the day. It's kind of introducing many concepts, but the one thing I'm happy with is the fact that I think it's going to be a revision from what I've heard today in different sets. I didn't expect it to be a revision, but I think it's going to play out like that. So having said that, let me just start straight off. So what we're talking about is creating the future of labs in India. Now, why am I talking about labs? I'm from Roche Diagnostics. We are the leading provider of diagnostic solutions across the globe and in India as well. Now, what do I mean by diagnostics? I mean your glucose testing, your creatinine testing, your molecular testing, pathology testing, advanced pathology testing in that case. So we are the leaders in all of these fields, and we essentially, whether it was Fortis or SRL or Metropolis, we're actually the leading provider. So I'm pretty sure that if you had any test done in any major facility in India, pretty much done on Roche. Having said that, I want to lead into I'm going to start a little clinical, but this is a fractional clinical just in case anybody is from the clinical background, so I started with this. But let me ask you these questions. When you go to a hospital or you go to receive healthcare, sometimes you go through the OPD, you talk to your doctor will kind of need to figure out nutritional status, have you gone with an infection, he'll look at this different things and he'll start making assessments of should I treat them on an OPD basis, should I admit. The first things, these are tests that they'll ask: hemoglobin, nutrition, total leukocyte count, is there an infection? Neutrophil and lymphocyte count is, so a DLC, essentially, is there an acute infection, a chronic infection? Platelet counts, dengue, so important. ESR, is there a background inflammation? Okay, you want to go, you've done that, you've assessed it, you want to do an advanced test, you don't want to do imaging. The moment you look at CT or MR, the next thing that they're going to look at is, hey, you know what is his creatinine levels? Can his kidney handle the contrast load? Or his or her? So these are questions that they're asking. Now, hey, you know what, do they have diabetes? We're the diabetic capital of the world. Does he have diabetes? Again, the only way to get data for that and to answer that is fasting blood sugar, postprandial glucose, HbA1c. These are tests, right? Then we go on further. It's like, hey, you know what, I've inundated a person, somebody to the ICU. Should I admit them? Should I change the drug? Should I move to discharge? All of these are hospital and healthcare decisions that are made, and they're all made based on data received from the lab. So data for decisions, in this case UTI, in this case oncology, data for decision making in hospital and healthcare has to come from the lab. That is the central point, and that's how hospitals function. Without that information, your decision making or whether to admit, whether to discharge, doesn't happen. So that's why labs are, they're right at the center of everything that is healthcare, and we really need to focus it that way. So I'm putting it right in the center of healthcare. Now, I've given you a whole bunch of tests in the previous slide. Core lab is basically biochemistry, immunoassay, hematology. That's what we refer to as core lab. We've got core lab. Hey, you know what? Do I need to look at infections, microbiology? Hey, do I need to look at tissue, pathology? Hey, do I need to look at special testing, advanced testing, flow cytometry? All of these are different tests. Now, all of these come in the big gambit of labs, right? When we're looking at all of this, we'll consider. But different setups. If I have a small hospital, I'll not need all of them. Or even if I need all of them, I may need a smaller throughput instrument. So my instrumentation and what I put into the lab will change with my laboratory setup. Now, let's talk about laboratory setups. All of these are hospitals that you know. Hospitals are, and we've run across this many times, different facilities. You have the structure, whether it's a distributed structure, whether it's a growing structure. All of these are considerations that you will have in terms of the facility or the structure that you will introduce a lab to, or you will grow a lab. So, different structures all require different design requirements. Now, having said that, new buildings, greenfield, great. You've got a lot of flexibility in your design. You can really think about how you're going to grow it and things like that. You've got a lot of flexibility. Old buildings, primarily brownfield, a lot of top discussions today. That becomes key, and that's primarily where a lot of labs need to be improved. That's a big gamut. And then you're looking at growing hospitals, hospitals that have multi-sites. All of these are different facilities in which you will look at how the lab, as it grows, how do you design the functionality of the lab, how does it need to serve the healthcare setup. Fair enough? Now, there's differences, and we've been discussing it through the day. In fact, in the morning, the fireside discussion was pretty much on this point. Is 4.4 great? Is 3.6 great? So when it comes down to lab, the ideal is 4.4, but 3.6 should be the minimum. Primarily because of all the HVAC, all the MEP that we are discussing today, all that comes into play here. So that's why we need the space for it, and we also need the width for it. Because what's happening is that the lab is a dynamic environment. Diagnostics constantly improve. You want to have the latest. But the latest comes in different sizes. It requires you to already have instruments that are there in the lab, and then you're replacing them or you adding to them. So your design requirements in terms of the technology, instrumentation that you will put in, really keeps on changing with the demand, and it depends on the volume load of the hospital. So you see, you're looking at innovation, you're looking at volume, you're looking at so many factors, so you really need an open space. Now, let me go here. Now, another discussion that was there was, okay, I know all of these tests, I need to pick and choose from all the tests that I need. Okay, what kind of specialty do I need? I have that in place. But as we discussed today, now, laboratories are spaces where people work. They need to have administrative areas. They need to have support spaces. They need to have staff rooms. These are very important, and I know I'm repeating what was said today, but these are very important considerations for the hospital as well as for the lab. These need to be designed in so that you have a functioning workforce that can run the lab. So these are very important considerations. Now, if I have to take a little bit of class and say that 20 years back, this is the reality. Anybody design the lab, you'll see labs, one corridor on both sides, so-and-so rooms, and everyone walking in. Now, I'm sure you're all are designers. You can see the fire has safety hazards in it. You can see the HR problems in it. Immediately, that's what you're seeing. But this is the classical lab. We need to shift from this mindset. We need to shift from this mindset and allow the lab to be a more dynamic space. And I'm going to go so as far as to say, I'm looking at an open space. Now, I don't want divisions because I need to understand that any lab that I introduce today, it has to last me for the next 5 years, 5 to 7 years. And also, it has to change with the incoming technologies. It has to have that scalability in it. So how do I best orient my lab? As soon as I start building walls and sectioning off labs, one, it creates a problem for me because I have no space to grow. The second is that from an HR perspective, every time I split the lab up and I divide it, what I create is fiefdoms. This department, that department. And really, when you're looking at a hospital, I need my test done. Which department it goes to really doesn't matter. The test should be available, facility should be available, it should be efficient, I should be able to use workforce. Basically, a lab tech is a lab tech, we can use them in multiple areas. So there's all considerations. But again, you'll have to titrate it with realities. So how much of the workforce can you mix? Which areas you can mix? How do I set up labs that are sustainable and we can grow in? So this kind of space, you really need to think of when you're designing. So no longer blocked out labs, but centralized labs, and I'm using the word very carefully, centralized labs, where majority of the workload can be taken and managed. So core lab usually stays the bulk of the workload. Manage your bulk, make sure that you have enough instrumentation there. Other areas that need to be segregated, for example, your pathology lab, because of the fumes that are there. If you're looking at microbiology lab, you're looking at higher biosafety levels. So all of these are considerations that you can make, but make sure that you have it as flexible as possible. For example, another thing that I would say is like, so when you're looking at a people space, remember you're designing these labs so that people can work better. People are always at the center of the discussion. How do I make a lab that is flexible, that caters to people? Examples are like this. So if you see, I'm looking at a 3-man corridor. So 3 people can move within a 1.5 meter space. 3 people can move. So anybody who's working on either desks has the space to move. When I put instrumentation in, so from bench to instrumentation, I've got flexible frameworks where I can put instrumentation in and still have that functionality of space. Having said that, this is what there's so many topics to delve into. If I come down to the most exciting topic, sustainable. So it's green labs, sustainable labs, managing energy, managing water, managing waste. Carbon credits, we were having such a big discussion on carbon credits today and what it took to build a hospital. What about running it? These are constraints, these are ideas that you need to build. So when we're looking at building labs, we're looking at making sure that the space is optimized for what we need to do. So what we need to do and deciding what we need to do as a healthcare institute and as we need for the healthcare system that we're designing it for, we need to design the space. We need to make sure that the space, when we're talking about, like we were talking about how much time people take to move within the space. So how is my material, okay, let me start. How are my machines placed in that space? How is my material circulating in that space? And that material could be external material that's coming in that I need. So reagents on one side, samples on one side. So I'm looking at material in the lab. And how was my manpower? I'm using non-inclusive language, but I'm going to say, how is my manpower? So 3 M's, material, machine, and manpower. How do I manage it? Making sure that I meet all accreditation guidelines, making sure that the people I use are that I get in the lab and are working in the lab are the right amount of people. That are also the right. We can also use them more efficiently. So if you departmentalize people, so if you have 2 people that can do the same job, like for example, serology, hematology, immunoassay, pretty much they can use the same. You can combine that technical force together. Think about it. How do we optimize the space for them, give them the privileges that they need? Make sure that over time we're looking at growing labs. How do I look at growth of this hospital? So today it's a 100-bedded hospital, and we're looking at modular growth. So if it's a 100-bedded hospital today, what are the loads? If it's a 200-bedded hospital tomorrow, or 300, how do I prepare for that, and how do I prepare for my instrumentation? Finally, the financial impact of the lab is self-evident. Now, having said that, this is important. We need to have a clear vision, as best as you can, keeping all stakeholders in mind. We need to do a framing, we need to do the design, so we've been talking about a lot of design engineering and things like that. It's very critical to have this. Very important to have benchmarking. So there's a lot of benchmarking as in what are other people doing. Learn from everybody else in the industry. Make sure that we have those marks available. Make sure that we have these so it was very nice seeing the BIM diagrams that were there, essentially leading to that. So enough of what you want to do, how you're going to do it, planning on it, projecting it in the future, and then taking to a conceptual design that then can be taken forward into full-on design or development. So now, this is what we've done. So this is in fact, as far as I know, this is the only data that's available in India. This is a work that we've done with Kaho India, where we have plotted workloads of all labs, so both hospital and as well as commercial laboratory, in terms of number of beds on the x-axis and sample load. So this is specifically for core lab, but essentially it gives you a sense of how hospitals will grow in India. And this is actual data from over 100 hospitals in India. So we know how Indian labs will function. And not only Indian labs, Indian hospital labs. So this is a clear indication and clear data that we have. It's initial Indian data. There are benefits to it, there are downsides, but essentially it's a start, and we've definitely made that start. The idea is to grow on it, use it, and then make more sense of it. So this is data that's available with us. So maybe to close on this, what are the challenges that we need in lab design today is that we need to what we have to design for. We're designing for reliability in less time. We're designing for revenue. We're designing for efficiency and scale. We need to understand the value of the lab. So value of the lab, I'm ending with that, but it's actually the paramount thing. What is the lab delivering for you and for your health system? Really think about that and then go on to developing a lab and really take it further from there. Having said that, let me show you what an interesting, this is a massive scale. I don't expect it to be as this scale for different labs, but if I tell you a really massive, so we were talking about 5,000 bedded hospital, this is a lab that I would put in there. If you see, you've got whole bunch, this is a fully robotic, fully automated lab, a lot of machines. If you see a number of people versus the space, you really get a sense of what we're talking about. But I'm showing you very high-level labs. I don't expect this. I expect one of these machines or 3 of these machines to really fulfill the needs of a 100-bedded hospital or 200-bedded hospital. So I'm talking about scalability, and it scales at different levels. But really, it urge hospitals to think about design. Once they think about design and what they want from the lab, we can definitely work together and collaborate and make a space that is workable for their staff, for their value delivery in terms of a healthcare system, and for them to be efficiently growing over the next 5 years. Having said that, that's where I end my presentation. Thank you so much.